So I'm Sam Furneaux from the Victorian Refugee Health Network at Foundation House, which is the Victorian Foundation for Survivors of Torture. I'm just going to apologise straight up. I have one slide. I had a small administrative bungle yesterday and only realised I was presenting yesterday. So you'll be very familiar with these resources by the end of my presentation, because that's my one slide. But I would like to just acknowledge the partners in this project. So many people have contributed to the two projects that I'm speaking about, which is the update of the Australian Refugee Health Practice Guide and the Refugee Health Assessment Template. So I'll speak mainly about the Practice Guide, which is a national resource. The Health Assessment Template has national applicability, but it is targeted towards Victorian users. So my project colleagues, Marilyn Spratling, who's a refugee health nurse practitioner, Morgan Moran, who is a practice nurse in a private practice, Dr. Kate Walker, Dr. Joanne Gardner, and Tony Mansfield. So people from refugee backgrounds, as you know, can arrive with complicated or undiagnosed health conditions. This can be as a result of their experiences in the countries which they've fled, but also their journey to Australia, which could include detention for some people. And so on arrival, healthcare is really important, but at the same time there are a lot of competing settlement needs for people, and health is not always their first priority. So ongoing care is equally as important. And so these resources are designed to support people in primary care in a range of settings, and with various degrees of experience working with people from refugee backgrounds. So we know that general practice and primary care providers are very busy, very time poor, often asked to do a lot, often asked to know a lot, and often working with people from refugee backgrounds is no different to working with other people, but sometimes there's a confidence that's required to work with an interpreter or work with potentially unfamiliar health conditions. So the Australian Refugee Health Practice Guide is an update of an existing resource that was first developed in 1998. It's had a number of rebranding and name changes. So the previous edition was called Promoting Refugee Health, so people might be familiar with it. It's a sort of an A5 booklet. There's a thick booklet, and then there's a shorter desktop guide version. So it's been rebranded now to be the Australian Refugee Health Practice Guide, and the project, sorry, I've lost where I was going. The project has a number of partners in each of the states to make sure that it is reflective of what's going on in various states. Service models obviously differ, so it does try to meet a wide audience's needs. So since the last update in 2012, there has been the update of the Australasian Society for Infectious Diseases and the Refugee Health Network of Australia recommendations for comprehensive post-arrival health assessment for people from refugee-like backgrounds. And so they had a very rigorous process to determine the clinical recommendations for assessment, diagnosis, screening, treatment of a range of common health conditions. So the challenge for us was to try and incorporate those recommendations into this resource, as well as tailor them for a primary care audience, and make them a bit more accessible. I'll talk a bit more about the challenges with that if I have time. So the process for updating the resource, we had a national project advisory group, and we had representatives from APNA, from Refugee Nurses Australia, from the RACGP Refugee Health Special Interest Group, Australasian Society for Infectious Diseases, Refugee Health Network of Australia, Settlement, and Primary Health Networks as well. So we also brought into our project team 2 clinical practice experts. So we had a GP and a nurse who provided sort of ongoing advice and support. I'm not a clinician, I'm not a nurse. They were sort of go-to people that we could try and interpret some of the advice that we were getting from some of our writers, reviewers and editors. So the website, the link to the website is on there, and there is also a poster out in the foyer, which is what I thought I was bringing. The project advisory group, I guess, gave us a lot of advice at all stages of the project, but around navigation of the website, sort of branding, sort of usability and function, and what primary care providers look for when they are using a web-based resource. So it needed to be very clean, credible, intuitive, which was, I guess it was a steep learning curve for us developing a website. So the resource hasn't previously been a website. And this is where we've been able to incorporate the ACID and Rihanna clinical recommendations. So although we weren't able to change any of their content, and we wouldn't want to, what primary care was saying was that they wanted to be able to access the short, sharp recommendations up front. They want to know what to test for, what to do with the test result, and where to send people, whereas the recommendations are only printed in a hard copy book or accessible via PDF, and so there's a lot of background and, you know, all the stuff. So that is all still on the website, but we've tried to just make those recommendations a bit more accessible in terms of you able to click on, also on every page that a recommendation is on, straight up is the recommendations, and then if you want to, you can click it through to the further information. So we also did a lot of content sort of mapping because it was important not to lose what was in the previous Promoting Refugee Health resource, which included lots of sort of practice tips around approaches to working with people from refugee backgrounds, approaches to communication and interpreters, whole of practice approaches was something that we incorporated into this edition. What else? Oh, yeah, you can see it on the website, but the tabs are, so they have been expanded since the previous edition. So the new content areas are around working with particular population groups. So there's specific information around working with children from refugee backgrounds, adults from refugee backgrounds, people living with disability, older people, men, women's health. So that's all accessible on the website, and the whole of practice approaches, as I mentioned. So we had quite a complicated process of writing, reviewing, editing content. So all of the content, I have a diagram for another presentation that makes it look very kind of linear and straightforward, but it was very much sort of lead writers would consult with their colleagues, versions of content would go round and round. Everything was reviewed by a nurse and GP, and also by the clinical practice experts. And all of the contributors for the guide are listed on the website, so you can see who's contributed to which content areas. We also sought community advice, so that was for both the practice guide and the refugee health assessment template. And the approach to community advice was that for the practice guide we circulated a summary of the community advice to all of the content writers and reviewers so that could inform their update, and we also have used it to inform some of the practice tips that are on both the website and in the health assessment template, particularly around language, and we'll also be putting, they're not up there at the moment, but we will be putting a lot more of the quotes on the website for people to see. So state referral information, that was previously printed in the hard copy desktop guide, and it was recognised quite early on that is probably the weakest part of a hard copy resource because it goes out of date so quickly. So the decision was made not to include that in the printed resource, but to direct people to a link on the website. So we worked with partners in all of the FAST agencies in each of the states, and we've really encouraged them to consult with their primary health networks, their local Rihanna reps, the refugee health nurses, about what information is needed. Is there already an existing resource that we could link to instead, and what's the best layout and format for their state referral page. So on the website you'll notice that the state pages, and they're not consistent, they're all different, and that was based on the advice for their local services. Some service systems are obviously more complex than others. And so I guess in doing that we're hoping that will sort of increase the sustainability of the project, because those people are responsible for updating and maintaining that page. So although it was a bit of a process trying to, lots of people hadn't done website work before, including me. And so it was a bit of a process, but I think now that it's established, as information becomes more up to date, those state representatives will get that feedback, and they can make the updates themselves really easily and quickly. So the website is now live, but we are having sort of a period of about 3 months where we're asking for feedback. So I would encourage you to go onto the website, have a look around. There are still some things that we're fixing, and that's all I can see whenever I go onto the website. But please give your feedback. We've done a lot of consultation at various points in this project, which has all been incredibly useful. And with the website, we are able to make changes. So 5 minutes, okay, thank you. So I would encourage you to get in touch. Also, the desktop guide, so that's just in the final stages. It has been endorsed by APNA. And we're just negotiating with RACGP about their acceptance as a clinical resource. So once we've finalised with that process, we will be printing the hard copy resources, and they'll be distributed through your local torture and trauma agency or potentially a refugee health service. So there'll be information on the website about where you can access copies. And we've also got some promotional business cards that are kind of good for people. You can stick them on the computer for practices that you work with, people that you're working with. So you can also get in touch if you'd like some of those. And then there are some supporting booklets which will also be accessible on the website, and they're in various stages of being complete. So just quickly, the refugee health assessment template, it's based on the clinical information from the guide and from the ACID and RIANA recommendations. So the consultations to inform that were very much around platform, usability, flow of how people want to do things. So it is tailored for the Victorian context, where we do have a decentralised sort of system, and people doing refugee health assessments might be in community health or general practice or specialist services, so it can be used by a range of users. But you are welcome, obviously, to use that, and it will be compatible with medical director and best practice. And that's almost finalised. Again, we're just waiting for RACGP endorsement, but it has been endorsed by APNA. So that's about all, but please have a look at our poster, and I have put some of the business cards out there, so feel free to take as many as you want, and get in touch and let me know what your experience of using the website is, good or bad, because we've heard it all and I feel like I have very thick skin now. So thank you.